Training caregivers to effectively manage difficult behaviors and aggression in clients is crucial for their well-being and the safety of both clients and caregivers. Let's delve into some common challenging behaviors and how to address them. Abuse of a caregiver. Abuse of caregivers is never tolerated. If you experience any form of abuse from a client, whether it's inappropriate touching or comments, please inform your supervisor immediately. Your safety is our top priority, and we are here to support you. Accepting care and disliking new caregivers. Clients may sometimes have difficulty accepting care from new caregivers. This adjustment period is normal, and it is important to be patient. Refer to the client's likes/dislikes page in their binder to help build rapport and understand their preferences better. Refusing to shower. If a client refuses to shower, find creative ways to encourage hygiene. Instead of saying, "Let's take a shower," try, "Let's get cleaned up." You might also consider using no-rinse products to help them stay clean.
My mother used to shower every day. Now, if I don't remind her, she refuses to bathe at all. If I try to help her, encourage her to take a bath, she argues with me and gets upset, says she's afraid of the water. What can I do? Mom, it's 8 a.m. Time for your shower.
Oh, I don't need it. I don't want one.
Mom, come on, please. We've gone over this over and over.
No, leave me alone. Don't touch me.
Come on. It's been a week since your last one. You need one. Please, get undressed.
A person with dementia will often refuse, withdraw, or fight during a bath or shower. When you're helping someone to bathe, it's important to be sensitive and tactful and to respect their dignity. Remember, washing is a personal and private activity. Bathing can be scary for patients as dementia progresses.
Okay, Mom, it's noon. It's time for your spa treatment.
Oh, I don't really want to go.
But you love the spa. Makes you feel like a queen. Yeah, and after that, we'll go to your favorite restaurant for lunch.
Well, okay, I guess.
All right, good. Let's go. So first, let's start by unbuttoning your shirt. I'm going to do the top button, and then can you help?
Okay.
Okay. Good job, Mom. Okay, Mom, I'm going to put a little water on your toes. No, test it. See if it's okay. How's that feel?
It's warm.
Good. Now let's wash down there. Can you do that by yourself?
Yes.
Great. There you go. Okay, we're almost finished. I'm going to turn the water pressure on low and fill up this cup with some water. I'm going to stand up. You just sit right here. Okay? Just lean your head back and pour a little bit of water on you. And we're going to gently massage your hair with your favorite gardenia scented shampoo. How does that feel?
Yeah.
Reassure your loved one that even though bathing is a very personal activity, you're happy to help. Ask how she feels and how she would prefer to do things. Here are some additional tips on how to help your loved one bathe. Be flexible on the time. If your loved one doesn't like to bathe in the morning, try a different time of day. If the word shower or bath causes anxiety, use a different term like spa or get clean. Make the bathroom inviting by using flameless candles, aromatherapy, or soothing music. It's important that your loved one feels safe. Install handrails and use a shower chair. Limit bathing to twice a week and give sponge baths in between. Let her know what you're about to do, one step at a time, and have her help as much as possible. Use a towel to drape over her to provide more privacy. If you don't have one available, Consider installing a handheld shower head. Being able to aim the water can be helpful and less stressful.
Paranoia and hallucinations. Paranoia and hallucinations can be distressing for clients. Be aware of how shadows and lighting in their environment might contribute to their fears. Stay calm and avoid telling your client that they are seeing things. Instead, offer reassurance and comfort.
My mother's been waking up in the middle of the night and seeing things in her room that aren't actually there. We're both exhausted during the day because we're not getting enough sleep at night. Good night, Mom.
Honey, help me.
What's wrong, Mom?
There's an evil man in the room.
Mom, please. There's nobody here. No one's here. Go back to bed. Come on. Look, there's nobody here. All right? Go back to bed. We've got a big day tomorrow. Come on. Good night, Mom.
A person with dementia may experience hallucinations when the disease affects the regions of the brain that are responsible for interpreting sights and sounds. Hallucinations commonly involve seeing or hearing things that aren't there. They can transform ordinary, everyday experiences into frightening episodes. A good approach to reducing hallucinations is to identify and eliminate the objects or things that trigger them.
Honey, help me.
What's wrong, Mom?
There's an evil man in the room.
Oh, really? Let me take care of it. It's okay. Oh, I see. Okay, come on. Come on, I'll take care of it. Now you stay out here. Now he's gone, okay? I'll sit with you until you go to sleep, okay?
Okay.
You know, Mom, I think we should keep your coat rack outside so you have a place to keep your jackets when you come in.
Oh, okay, dear.
Okay? Okay. Good night.
Remember, patients experiencing hallucinations are having a difficult time interpreting their surroundings. Remain calm, reassuring, and try to identify what may be triggering the hallucinations. If hallucinations persist after trying to eliminate them, be sure to discuss this with their doctor. Here are a few tips on how to reduce hallucinations. Look around and try to see things through her eyes. What might cause her to misinterpret what she sees? Identify potential triggers such as open curtains, shadows, mirrors, or televisions left on. In the bedroom, use a nightlight to create a more peaceful sleeping environment. Always remember to remain calm and reassuring. Do not yell or scold her. Help her back into bed and reassure her that she is safe.
Hoarding. Hoarding behavior can stem from personality traits or conditions like Alzheimer's. Unless specified in the care plan, do not try to organize or clean up the client's belongings without their consent, as this can cause stress. If the hoarding behavior seems unsafe, report it to your supervisor. Understanding client anger. There are many reasons why a client might become angry. Pain, UTIs, miscommunication due to vision or hearing impairments, hallucinations, unmet needs, medication side effects, feelings of embarrassment, or rushing can all contribute. It's important to identify the root cause of the anger to address it effectively. Diffusing the situation. When faced with an upset client, be a good detective, as Teepa Snow teaches, to identify the problem. Determine if the client needs a hug, space, or if they are simply hungry or tired. Change the subject if appropriate, and offer a change in scenery. Always listen actively. empathize with their feelings, and remain calm, even if you are frustrated. By understanding these behaviors and using compassionate, patient approaches, caregivers can create a safer, more supportive environment for their clients, ultimately enhancing the quality of care provided.